The first two Ignite sessions were absolutely fantastic, and I know we're in store for two more excellent presentations. We will now be hearing from Superintendent Vince Butera from Manhasset Union Free School District and his presentation, A Collective Priority and Responsibility, and then Hudson Valley Community College President Roger Ramsamy and his presentation, Meeting Generation Alpha. Please join me in welcoming Vince to the stage.
It's about time. That's when I knew the true impact of what I had been hearing for months, beginning in the summer of 2017, when our then Director of Guidance stood up during an administrative retreat and said in front of the entire administrative group, "I'm afraid of what's going to happen." Sentiments that began to surface a theme that I would soon hear from many others, including our faculty and our staff, who, when asked to describe the typical student in our district from the earliest of years through their intermediate years and then through their secondary years, hit on a similar theme, one that we knew we had to address. As superintendent of schools in Manhasset, it is an absolute privilege to work in a place with so many caring individuals. But when we begin to listen and hear that for far too many, their experience is different, I knew we had to do something. So when I spoke to student leaders and asked them, "How do you feel about us addressing this issue of mental health?" one young girl looked at me and said, "It's about time." I'm superintendent of Manhasset Schools. It's a privilege. I work with so many wonderful adults. I work with students who are some of the kindest students you'll ever meet. I work with students who are so accomplished that they're recognized not only at the local level, but they're recognized at the state level, national level, and oftentimes the international level. But if we were going to be true to our mission and ensure that we focused on each and every child, then we needed to make sure we weren't assessing our effectiveness by the success of many, but rather by the success of everyone. So for us, it required us to open our eyes and see what was in front of us, to question how we were doing things. And what we found was no different than what many of you are finding, what many of our colleagues are finding across the country. Now, it's really easy to ignore national statistics. It's much more difficult to ignore the words of your students. And this is what our students were telling us. Our students were telling us that they were struggling. Our students were telling us that they were having a difficult time identifying their emotions. Our students were telling us that they were having a difficult time regulating their emotions. And when we asked our students, "Do you have someone you can go to if you have a school problem?" most of them said, "Absolutely." And then when we asked our students, "Do you have someone you can go to when you have a personal problem?" far less were able to do so. As superintendent, it's my responsibility to make sure that we focus on each and every child. And when you have 400 to 600 students telling you it's not perfect for us, that drives our work. Now, I heard we have too much on our plate: standards, exams, parent pressures. But if we consider the fact that our job is to prepare students not to be successful in school, but when they leave us, far too many are struggling, and not because of academic reasons. Mike earlier spoke about the fourth revolution. If our job is to prepare students with the skills that they'll need to be successful beyond college, many of those skills are not academic. So I share with you, if you consider you have too much on your plate, this is the plate. So what are we going to do to ensure that the experience for our students is better than it is for many? Now, none of us created the world we live in. None of us are personally responsible, but this is the world we're living in, where we're as connected as we've ever been, but more disconnected than we've ever been. And there's no simple solution. There's no checklist item that you can go down and address this problem. We knew that. We also know, and I've learned this as superintendent, as an administrator for many years, that when you start to think that you're the smartest person in the room, you've just proven you're not. I have many brilliant people around me. Sometimes my best form of communication is keeping my mouth shut and just listening. And I knew that if we started to listen and we started to raise awareness, then we can actually do something. So we began to put people together. Our board members, our faculty, our students, our parents, community organizations. We brought them all together. We asked our faculty, tell us, when you hear about mental illness, what do you think of? This is what they told us. Now, what's the implication of this? Well, we speak about mental health. We speak about mental illness, and too often we equate the two. They're not the same. Not many of the people here have mental illness. We all have mental health. But for a student who's struggling with mental health, how do you go and access help when people think it's the same? So our responsibility became, we need to make sure people understand the distinction, that working on mental health doesn't mean you're mentally ill. And just because it's 1 in 5, we can't ignore because it's really 5 in 5. And our students come to us with an invisible backpack that's filled with joys and trauma and anxiety. And we also recognize that we don't have all the answers. But luckily, there are many people out there who do. So we began to partner with all different organizations. And we began to say, how can we design our system to ensure that no one falls through the cracks? And that's what we are as superintendents. We're architects. We design the systems that allow us to get from where we are to where we want to go. So we asked our students, tell us, what do you think we can do? We need your help. They got together and they said, you know what? We want to bring everyone together. Parents, faculty, staff. A couple iterations later, they said, you know what? Forget the parents. We just want to talk to the faculty. They sat down and had a conversation about this is what we're feeling, this is what you're feeling, let's work together. We brought together our district wellness team, all our psychologists, all our social workers, all our mental health professionals, and said, we need your help. What do we need to do to raise awareness, to build capacity? They've been driving our efforts, including providing mental health 101 training, not only for all our teachers, but for our bus drivers, for our clerical staff, for everyone, because we recognize this is all of our issues. What we also did is to take a look at our systems, instructional support teams, our child study teams, and said, are we actually communicating with one another, or are we working in silos? So we began to examine some of those practices. What we also began to do is to take a look at our classrooms. Our teachers, many of them teach content, but they all teach children. So how do we help them create the environment where they're actually able to nurture the skills that we speak about, many of those social emotional skills? What we began to do is to say we need to reduce some pressures, so every 7th grader in our district now has a study hall. And within that study hall, several times a month, our mental health professionals go in and explicitly teach the skills that we know they need to develop. We also know it doesn't start in middle school, it starts earlier. So we ensured that we had a school counselor in each of our elementary schools. One of their functions is to go in and work with kids on the specific skills that we know they need to be taught. You don't catch math and science, well, you don't catch ESEL either. You need to be developed. We also took a look at our classrooms and said our classrooms need to be designed in a way that promote collaboration, in a way that promote relationships, in a way that promote the behaviors we want. We also took a look at our spaces for help. And we asked our students, where do you go to when you need help? Where's the social worker? Not one kid could tell me. The social worker is actually in the lobby of the high school. So we worked together and are redesigning an existing space that is underutilized to provide a space for mental health professionals to be together, but also a space that students will want to go to in the morning, during school, and afterwards. And I asked one student, what does it mean when you ask for help? And he looked at me, smiled, he goes, it means you're human. What if every child had the same attitude? What if every adult had the same attitude? Now, earlier today, we heard from Mike, and Mike, you deserve all the accolades you get. You're an inspiration. Okay? But of all the words that Michael has spoken, and he speaks a lot, what resonates most is his encouragement that we all share. Because the work we do changes lives, and in some cases saves lives. And we simply can't do this alone. Thank you so much.